Hello, my name is Miguel Ángel Mandujano Camacho, and I'm a med student of the NET. Today, I'm going to talk about heart. Gastro reference to stomach. Esophageal stands for esophagus, and a reflex means to flow back. So, gastroesophageal reflux disease, or HERD, is a condition where a decreased tone of the lower esophageal sphincter causes an excessive amount of stomach acid to flow back into the esophagus. This causes the epithelium of the lower esophagus to constantly renew, and it's when it is replaced by the colon epithelium that's called Barrett esophagus. Risk factors for heart include obesity, a fat-rich diet, caffeine, alcohol, and smoking. Okay, now the most common symptom of chronic heart is pyrosis, also called heartburn, which is a burning pain in the chest, just behind the breastbone. Another common symptom of regurgitation, where undigested food and a bit of gastric acid go back into the mouth and cause acidic taste or even damage of the enamel layer of the teeth. With stenosis, they may be dysphagia, which is a fancy way to say difficulty of swallowing, and a reflex go into the respiratory tract. Hair might be also present with chronic cough and hoarseness. All these symptoms, specifically heartburn and regurgitation, worsen when they're lying down. Most commonly, HERD is diagnosed by clinical symptoms and other therapeutic challenges down. These mean proton pump inhibitors, which are medications that inhibit acid secretion, are given, and with HERD, symptoms improve. However, the most accurate study to diagnose HERD is a 24-hour pH monitor in lower esophagus, where a thin tube with an electrode attached in a place inside the esophagus in order to detect how long the acid reflux stays in there. X-ray with varying construct of the upper gastrotract can be useful to identify complications like ulcers or esophageal stenosis. Also, endoscopy, which is when a tube in a camera and it's replaced into esophagus, and a biopsy are essential to diagnose Barrett's esophagus to evaluate the risk of cancer. In the biopsy shows the normal intestinal cells under the microscope, and there are signs of inflammation. This is called non-dysplastic Barrett's, and the rate of developing esophagus cancer is very low. However, cells look abnormal. That's when called dysphagia, and there are higher risks of developing adenocarcinoma. Lifestyle change, antacid, and proton pump inhibitor are the first line treatment for heart. Life, Lifestyle change, including losing weight in overweight individuals and avoiding spicy, fatty food, chocolate, coffee, and alcohol. Additionally, keeping the head in elevated during sleep and not lying down immediately after a meal are recommended. Medication includes antacid, which neutralize acidity of the gastric secretion, and proton pump inhibitors, as well as H2 receptor blockers, which secrete hydroelectric and production of the first place. Another choices include protein medication, which increase the tone of the lower esophagus sphincter, and GABA agonists, Paxoflane, which inhibit tracing-less reflection, especially after meal. Hey, so thank you so much for watching, and don't forget to subscribe and give me a like. If you really watch these videos, you can help me with just one like. And also, if you want to follow me on all my social networks, you can see it over here. So, see ya.